So we are going to continue with our lecture covering the heart. The heart is a four-chambered organ. It's about the size of your fist. It's located in the thoracic cavity between the lungs. It's located about 2/3 of the way to the left. That has to do with the reason that the way that the blood vessels, the main ones, the vena cava and the aorta, branch off of it. Now here we have the heart. The most challenging part of studying the cardiovascular system has to do with the blood vessels associated with the heart. Now, when we look at this, the first thing you want to do is you want to be able to tell your right from your left. When you do that, you're going to look at the thickness of the wall of the heart. The left side is twice as thick as the right side. That has to do with the way the heart circulates the blood. The upper chambers are called the atrium. So we have our left atrium, right atrium. We have our left ventricle, our right ventricle. The separation of the right and left is the interventricular septum. The right side over here is going to have the tricuspid valve. Right here between the atrium and the ventricle we have our mitral valve. The strings that attach to the valve are called chordae tendineae. The muscles they're attached to are called the papillary muscles. Right here we have the pulmonary semilunar valve, and you'll notice that it leaves from the right side of the heart. Right here we have the aortic semilunar valve, and it leaves from the left side of the heart. The pulmonary trunk is an artery. It is blue because it has low levels of oxygen in it, so our pulmonary arteries are blue. If we go back to our poem, arteries are red, veins are blue, except in pulmonary the reverse is true. It deals with the level of oxygen within the blood vessels. We have our superior vena cava, our inferior vena cava, our aortic arch with our brachiocephalic artery, our left common carotid artery, and then our left subclavian artery. So the heart is enclosed in a sac called the pericardial sac. It separates the heart from the rest of the organs. It has fluid that's within it, and this helps to lubricate the heart. The pericardial cavity is that cavity where the heart sits. The layers of the heart: the endocardium is the thin layer lining the heart chambers. The myocardium is the heart muscle itself, and the epicardium is the outermost layer. As mentioned earlier, we have a four-chambered heart. It has 4 valves in it. The upper chambers are called the atriums. On the outside, they're called the auricles. The wall that separates the 2 atria is called the inner atrial septum. Sometimes at birth, it does not seal up. We'll talk about that with fetal circulation, and you may hear of a baby being born with a hole in their heart. That's called the fovea ovalis, and what they do is they have to look and see, does it close up on its own, or do they need to do surgery and put in a stitch or put in a patch to help seal that up. Once it is closed, it does leave a little kind of like a scar area of where it was open, and that's called the fossa ovalis. The 2 lower chambers are called the ventricles. The wall between the ventricles is called the interventricular septum. The strings that attach to the valves are called the chordae tendineae. The muscles they attach to are the papillary muscles. The valves between the right atrium and right ventricle is called the tricuspid valve. The valve between the left atrium and left ventricle is called the mitral valve. The trabeculae carinae are the ridges in the walls of the ventricle. If you hear of a prolapse, this is where a valve has been leaky. The chordae tendineae has stretched out of shape, and then the valve is not being held in place. So again, going over the valves, the bicuspid valve is an old term. Mitral valve is the new term that's being used for the valve between the left atrium and left ventricle. This is the one that's most commonly replaced because the left side pumps to everywhere in the body except to the lungs and back. The tricuspid valve is the valve between the right atrium and right ventricle. The aortic semilunar valve is from the right ventricle to the aorta. The pulmonary semilunar valve opens from the left ventricle and goes to the pulmonary trunk, which is an artery. Now, we think because the heart is pumping blood everywhere in the body that the heart gets plenty of blood, but the heart actually needs its own circulatory system. And so most of the heart problems are due to this circulatory system breaking down or being blocked. And the circulatory system associated with the heart is called the coronary circulatory system. So some different terms that are associated with this: angina is chest pains. Infarction is another word for a heart attack. So a myocardial infarction is going to be a heart attack because we have some kind of weakness in the heart. It could be an embolism, it could be a thrombolism, it could be a buildup of cholesterol that's blocking blood vessels. We just have to look and see what specific cause is associated with each condition. Coronary artery disease is the number one cause of death in the United States, and this is because we are a country where we don't exercise, we eat a lot of fatty foods, we get a lot of cholesterol buildup in our blood vessels, they become blocked, and then they begin to damage the arteries and damage the heart. Heart murmurs are typically due to a leaky valve. It can be because the chordae tendineae are faulty. It could be because there's damage to valves or cusp. It could be due to disease. It could be due to injury. It just varies. Looking at blood pressure, the atria will contract at the same time, and they pump blood into the ventricles. When the atria are contracting, the ventricles are relaxing and filling with blood, and then the ventricles will contract and the atria will relax, and then they will refill with blood. So that when we talk about blood pressure, the systole is the top number, and that's the phase during contraction. Diastole is the bottom number, that's the phase of relaxation. And the blood pressure is really an indication of the health of one's blood vessels. So that during ventricle diastole, the tricuspid and the bicuspid are going to be open. The two atria are going to be in systole. The ventricles are going to be filling up. And then it continues, and the atrials will go into diastole. The ventricles will go into systole. The valves will close. Semilunar valves will open up. Ventricle will empty. Then it continues. So we usually will have 8 seconds per cycle, or about 72 heartbeats per minute in an average individual. But here you can see some of the different heart rates of different animals. And so you can see that in a mouse it's like 376 beats per minute. You get to a camel, 28, a whale, 9. Humans, we're looking at around 70 beats per minute. When you listen to the heartbeat, they describe it as a lub-dub sound. The lub is when blood is being pushed out of the heart, and the dub is when the heart is being refilled. Remember that the heart is a cardiac muscle, so that it is branched. It has one nucleus where the branches come together are called the intercalated disc. Now we need it to be tightly woven together because when the cells receive an electrical impulse, that's going to cause the heartbeat. And for the heartbeat to occur, for that electrical impulse to pass through the heart, the blood cells have to be, the muscle cells have to be tight together. Factors that would influence blood pressure: you have blood volume, cardiac output, you have resistance to the arteries to blood flow. You can have hypertension, which is high blood pressure, hypotension, which is low blood pressure. A lot of different things that can influence the blood pressure. Now, I mentioned earlier, the heart is actually a double pump. We have the pulmonary circulatory system, which is where the right side of the heart pumps to and from the lungs. And then we have the systemic circulatory system, where the left side pumps to the rest of the body and back. So here again, systemic is where the left side pumps to the rest of the body and back, and that's why the left side of the heart is stronger and thicker than the right side of the heart. Now I would pause the video, and I would copy this down, because this is the circulation through the heart. It's one of our short answer questions. And so if we start with the aorta, it goes through the arteries. Remember, arteries carry blood away from the heart, veins carry blood to the heart. How we get blood from the arteries to the veins is through capillaries. So we go aorta, arteries, capillary, veins. Vena cava is the largest vein in the body. Then it enters the atrium, the heart. From the right atrium, it goes through the tricuspid valve to the right ventricle, and then it goes through the pulmonary semilunar valve, leaving the heart, going to the lungs, and then back to the capillaries, and then to the pulmonary veins. Now it's going to re-enter back into the heart. It's going to enter the left atrium. It'll go through the mitral valve to the left ventricle. Then it'll go through the aortic semilunar valve back to the aorta. Starts again. So again, we have those intercalated discs, which is how the cells are woven together. We have to have them tightly woven together for us to have our conduction system in order to send that electrical impulse from one part of the heart throughout the remainder of the heart. The electrical impulse is what causes the heart muscle to contract. It's going to be made up of the SA node, which is known as the sinoatrial node, and the AV node, which is the atrio-ventricular node. The sinoatrial node, or SA node, is found in the right atrium. It is known as the pacemaker of the heart. It initiates the heartbeat about every 0.85 seconds. Now this signal will travel across the atrium, and then it will cause the atrium to contract, and then it will load the ventricle with blood, and then it will send its message so that the ventricles are ready to contract. So the SA node is what sets the pace, and if it fails to work properly, that's when an individual will need a pacemaker. This impulse is going to then travel to the atrio-ventricular node. The AV node is located at the bottom of the right atrium, and this is what causes the contraction of the ventricles. Now the electrical impulse will pass through the ventricles, through the AV node, and the bundle of His. The bundle of His is what individuals used to call where the soul of man rested. They pass this impulse to the base of the ventricles about every 0.1 seconds. So the bundle of His, when we examine it, it is made up of a group of fibers that conduct impulses, that carry those impulses to the left and right ventricles. And then the ventricles can contract from bottom upwards. So again, the atrio-ventricular node is found in the septum, or the wall between the right atrium and right ventricle. It sends the impulse, and then it's going to allow for the heart to contract. It should be a very smooth, light contraction. When a person's heart becomes when you need to use a defibrillator and shock the heart, if the heart is not going through a smooth contraction, somewhere along the lines, somewhere the impulse has gotten off, and so instead of being smooth like a nice wave that you'd see in the ocean, it becomes very choppy. So to shock the heart, what you're doing is you're temporarily stopping the heart, restarting it, and you're trying to get that smooth wave to continue.